or educating them about some resource that they didn't know about that really improved the quality of their lives? Or
One patient was complaining about how her leg was hurting, and we kind of like showed her how she should, when it starts feeling painful, how she should position it and like
Mhm.
lift it up on the couch.
Nice, nice. Okay, I can work with that. That's very good. Like helping them with those small little things. Like small things make a big difference at the end of the day when it comes to your health. Um, did you also have to record their vitals and such when you visit them?
Yeah.
And considering the fact that you are visiting each patient in their home, how how do you keep track of what the each health or care plan is? You know?
We had like their folders that in a notebook we would carry around with us. And
Mm.
once we'd walk into that home, we would take out their folder and then we'd write down their
Ah.
vitals. And then once we get back to the actual build into computer, we would
Mm.
type down everything that we wrote.
Oh, so you wouldn't like present to a doctor or email a doctor like here's an update.
If there was like something wrong, but usually no.
Okay, so usually no. Hmm. Were you ever able to or did you ever feel like you had to recommend an improvement in an existing care plan?
No.
No, okay, no problem. Um, would you say that there was any specific nursing practice that you brought to the table in this experience? You know, like by implementing this specific process with these people, I was able to do my job in a much better way. You know?
Yeah, I mean, we like the techniques on how to lift the patients, so we don't get injury to ourselves. I know I implemented that a lot.
Hmm. Okay, okay, I can use that. I can use that. Um, okay, I think that's good for community health. And then next we have the children's hospital, right?
The women and children, yeah.
Yeah, women and children. Whoops, I have that written wrong. Uh, okay, wait. Why do I have two different things written over here? Uh, okay, so tell me a little bit about this particular rotation.
So we rotated between the labor and delivery floor and then the children's floor, like section, children's hospital section.
Um, were you helping? Which procedures were you specifically helping in?
Well, labor and delivery, I got to rotate like throughout the floor during the actual labor and delivery. I got to do the mother baby. So after she gave birth, I helped take care of the baby and the mom till she got better.
Mm-hmm,
And I
mm-hmm.
also got to help take care of them before they gave birth.
Mm-hmm. Can you elaborate just a little bit more about what kind of help you were providing them before and after? I mean, is it just providing them support? Is it making sure that their medicine or epidural is properly um, implemented? I don't think you implement an epidural.
No, I mean, it was mainly watching the vitals of the mother and the vitals of the baby was a big
Oh yeah,
thing.
that makes
And yeah,
sense.
giving her comfort, any medications she needed,
Mm-hmm.
just any questions she was, sometimes they'd be nervous because it was the first time they're giving birth, so we'd explain the process.
When
Um,
if any potential, if there's like father to be or family, how do you handle them in that situation?
I mean, usually most of them were very happy because they're like getting a new baby in the family.
Yeah.
So they were pretty easygoing and happy and just excited. They would ask
Hmm.
questions and we would answer, and that was pretty much it.
Okay, very good. I can use that. Ask questions, answer them. Uh, okay. Um. So you wouldn't be helping in the actual delivery process. It's just pre and post.
No, I did. I actually watched
Oh.
deliveries and helped, and I saw C-section and natural birth.
Oh. Okay. Just saw them. Did you like
Um,
be an
For
active
natural
helper?
birth, for the natural birth, they actually let me get a little more hands-on. C-section, because it's all like sterilized and stuff, we had to
Sir,
stand
yeah.
back and we just got to watch. Um,
Okay.
yeah, for natural birth, I was more able to like get hands-on, and I would like help the mom, like, position her legs right and just like tell her how
Ah,
to breathe and how to push.
like be in a very active helper position.
Yeah.
Okay. So once the baby is delivered, then you take them away to be, oh God, what do you call that test? Apgar test?
Yeah, we would do
No.
that in front of the mom because this was a baby-friendly hospital. So we wouldn't
Uh-huh.
actually take the baby away unless there's something wrong with the baby.
Oh, so that all happens in front of the mom and dad, or just the
Yeah.
mom. Okay, okay. And you would help in that, like just test. What do you test? I believe the reflexes, breathing.
Yeah, so
Um.
first we would stimulate the baby by rubbing the baby with the towel and kind of making sure the baby is warm. And then, yeah, we would test pulses, vitals. We would check the color of the skin of the baby, see if it's too blue or normal. Check the
Mm-hmm,
breathing. Um,
mm-hmm, mm-hmm. Okay.
yeah, and then we would lay the baby on the mom.
Mm-hmm, mm-hmm. And so how are you helping once delivery has happened? Like, is there a change in the questions asked, or in I'm going to word this very poorly because I know it's going to be stupid, but is there a change in the environment and mood once the baby is there? Like, is that when the nervousness comes in? Do the type of questions change?
Well, I mean, dealing with the mom is completely different because either if it's a
Yeah.
C-section, we have to take care of her wound and teach her how to
Oh.
clean it and make sure
Mm.
she doesn't get up and carry heavy stuff and like teach her how she
Yeah.
prevents it from opening. And
Yeah.
then if it was natural, we would have to deal with like their bleeding since they're still bleeding after the birth and make sure they're changing their pads and stuff like that. And like
Mm.
watch the bleeding, make sure they're not bleeding too much.
Yeah. Actually, isn't that something that you have to keep track of? Like, even like when the patient is still there, like after delivery, after passing the placenta, I believe there's sometimes a danger that there could be more bleeding or something. Or has
Yes.
TV been lying to me?
No, yeah, it's true. So we would even check their pads and like with throughout an hour, and if it would be get more full, like less than an hour, then she's bleeding too much.
Yeah, 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 yeah. Okay. Okay, perfect. I can use that. I can use all of that. Um, in this particular area, like labor and delivery, um, would you say that there was a lot of learning involved? Like, again, like taking notes,
Oh
reading
yeah,
up about, like, oh wow, I didn't know about this.
it was definitely a completely different experience because actually, like when before monitoring the vitals of the baby while she's still pregnant, you'd have to like kind of watch simultaneously the vitals of the baby and the mom at the same time, and you'd
Hmm.
have to learn how they correlate with each other, and that was all new stuff.
Mm-hmm. What I am wondering is, while doing your own research, did you find some journal article or something that talked about, like, oh, here are different strategies that you can use to calm down mothers to be or new mothers that you put into practice?
We put into practice. We actually had to do research about like stimulating the baby sometimes when to see if she is ready for birth, or how to get the mom like more dilated. And we would actually
Huh.
have to implement those and like actually get up and make her walk
Oh
and stuff
yeah,
like yeah.
you had to do that research yourself.
They made us, just to give us stuff to do. So they
Oh
actually
yeah,
made
that
us
makes sense.
research on the side and then actually apply it.
Hmm. Okay, because what I'm specifically wondering is that, like, I'm sure that whoever was your preceptor or your supervisor, they must have guided you, right? Like, okay, if there's a new mom, this is how you're supposed to deal with her, right? Like,
Yeah.
be friendly, be patient, answer all their questions, etc., etc. But you also did your own research just to see, like, hey, how can I, how can I be a bit, go beyond what I've been taught? Can I, can I do something else that I haven't been told? Like, maybe offering them, like, hey, you can do this exercise, or I can distract them using this thing that this other nurse has suggested. Anything like that?
Mm. Um, I guess I taught one patient like this breathing technique that I know, and she kind of used that during pain.
Wonderful, wonderful, nice. I can use that. Very good. Um, mm, I hope not. But, like, was there ever any situation where a miscarriage, or like the birth wasn't, successful, or it was too early? Did that ever happen?
No, I mean we'd have to deal with that, but they taught us just in case it did happen how to deal with that
Okay,
situation.
okay, okay. So I'll see whether or not to put that in, because I'll have to do a little bit more research on that. But okay, okay, that's good. Um, did you were you also part of the discharge process? Like, once the new mom is stable, the baby's stable. Did you help
Yeah,
after
I got
that?
to discharge a couple of women. Yeah.
Mm-hmm. And what was that discharge process like? Purely in terms of educating the parents or the mother.
They mainly couldn't wait to get home, so they wouldn't really listen. They're just like, okay, 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 we want to go home. So we would have to like be like, okay, sit down just for a second, let us say everything we have to say, and then we can let you go.
Did you provide, like, so I love the way you say, like, they're just so eager to go home, and they're not listening. So, like, would you write stuff down for them, or was there some brochure already prepared that you'd be like, for the love of God, take this with you?
Yeah, we had brochures, and sometimes, a lot of times, what we would do to make sure they actually heard is let them repeat everything we taught them.
Oh, smart. That's smart. Okay, love it. I can use that. Um, was there any particular challenge specifically for labor and delivery that you could say, like, oh, this was the hardest part about that?
Um, I love this force. I can't really say anything bad about it, but
Hmm. I think I understand. Like, I have a friend who is actually very close to finishing her nursing degree, and she's very, very recently started her rotation in labor and delivery. And I have never seen her so excited. Like, she's so happy every day, just like, she just says, like, it's a great um environment, it's a great mood, it's very uplifting
it
seeing
is. It's
that
nice. Yeah,
excitement.
happy. Yeah,
Yeah,
that's
exactly.
why I'm trying to debate between if I want labor and delivery or actually pediatrics, but um, yeah, it was nice for.
Yeah.
I guess dealing with the dads. Oh yeah, that was kind of difficult. I remember on the floor.
Oh, how come?
Sometimes we would deal with dads like one situation where a lady she gave birth and he was like, I was wishing it was a boy, but whatever, it came out to be a girl. And
Ah.
it's kind of like, some nurses like got offended and we just kind of had to like, just laugh. And sometimes the
Ew.
dads they wouldn't really want to help the mom, and then we'd have to kind of get them up because the mom would be too tired. And be like, hey, like let me teach you how to change the diaper. Let me teach you how to feed the baby. Stuff
Okay,
like
I
that.
love that. That is such a unique challenge, and I understand that. Like, they're either too eager, or they're like, they're guys about it.
Yeah.
How do you handle them in each case? Okay, so that is wonderful. Okay, and then talking about the children's hospital side, what were your responsibilities on that side of this? of this
So I was
experience?
on the general children's floor, and then I was in the neonatal ICU and then the pediatric ICU. So
Okay.
I got to go on all of those.
Okay. Can you repeat that? So neonatal. So that's NICU, right?
Yeah, the NICU, and then I got to go to the pediatric ICU, and then I
Okay.
got to go to the general pediatric floor.
Okay. Um. What were you like? What were your responsibilities? Were you assigned a specific floor, or were you just kind of like floating around between wherever you were needed, kind of thing?
No, it was more like each day of the week I would stay the whole 12-hour shift in a certain spot.
12 hour?
Yeah, it's a 12-hour shift.
Yikes.
Yeah.
Okay. Wow. Phew, I can't imagine that. Like I'm saluting you right now. Like, yay. Okay. How many patients or how many kids were you responsible for in any given shift?
In the ICU, always you take care of max 2 to 3 patients max. But then on the pediatric floor, I was taking up to 6 to 7 patients.
Mm-hmm, mm-hmm. Um, um, for specifically for Pete, like I understand, like NICU is like very extreme cases, like when they're underweight or they've gone through surgery.
Yeah.
Um, in pediatrics, though, um, like again, like are we talking about any specific cases, or was it more? Or wait, no, that would be general pediatrics, right?
The
Like basically, what
yeah.
kind of patients are we talking about?
So yeah, the neonatal, like you said, it was just preterm babies I would take care of and just make sure
Yes.
they grow correctly. And then for the general pediatric floor, it was just like any sick kids, very general, just like oh they came in with the flu or they have a
Hmm.
virus or something like that. And then the pediatric ICU um is obviously like more intense, but um
Like post surgery, basically.
sometimes but not really, and it was like kids that were just really 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 sick.
Hmm. So, so like you said, could be surgery, and what else? So, like those who are going through chemo or have some kind of immunodisease or what?
Yeah, those are examples that I saw.
Okay, I can work with that. Chemo plus immunodisease. Okay, I'd like to touch on neonatal really quickly because like that is very very difficult to just be in that situation, like like hopeful parents, their preterm babies, they might have severe issues, so like it's a lot more sober of an environment.
Hmm.
How do you manage parents in there, like how do you, what are you hoping for, or what are you aiming in that case? Like do you want to keep them hopeful, or like hey, you want to stay grounded? How do you handle that complex situation?
So first, we would make sure we provide as much information as we can. Like every time they would come in and check up on the baby, we would just give them a long list of every little thing. Like they even want to know, the moms want to know, like how many times you had to change their diaper. Like we would give them like specific details, or how many times we fed them, how many times we turned them. We would give them like pretty much everything that happened throughout the day. We'd also let the moms have as much access to the baby, so like let them touch them, hold their hands, just to make
Mm,
like let the mother feel a connection to her baby.
mm,
Um,
mm. Does that also include like I remember reading that babies specifically, they need that skin to skin contact, and that has a positive impact on their health. So like you would also help mothers with that?
yeah, if they're allowed to pick them up, we would let them carry them. If they couldn't, we would at least let her just like hold the baby's hand.
The hand, yeah. Okay.
Yeah.
Um So, like you said, educating them, telling them everything they need to know. Okay, I can work with that. Um, then let's talk about pediatrics ICU really quickly.
Okay.
Um, how would you describe the environment? Like, were kids nervous? Were they scared? Were they sad?
Yeah, it wasn't really like a happy environment. I mean,
Hmm.
usually most of the kids there were mainly unconscious or like sedated because they were had like so many medications and tubes and stuff.
Hmm. Hmm.
So we'd mainly be talking to the family more than the patient.
Okay, more to the families. Then how are the families like? How are they taking it?
Um, I mean, they would just be hoping for the best, and we would try to encourage them. Like everything's gonna be okay, and we're trying our best, and we're doing our best.
Hmm. Giving them all the information, being
Yeah,
transparent. Hmm. Um, and I imagine also answering any questions they might have about whatever care the doctor has prescribed, right?
yeah.
Hmm. In this case as well, would you be giving them recommendations about like, hey, this is more affordable for you, or
Yeah, sometimes because especially in the ICU, it's already very expensive,
yeah.
and the medications are very expensive. They're taking a lot of medication, so we would try to help them as much as they can to make everything affordable.
Wonderful, wonderful. Like I saw the other day, actually, I think it was on Twitter or something. It's like a simple delivery costs like $3,000, I think.
Yeah, it's
And
crazy.
if it's like a complicated delivery, then it can go up to like 5 digits, like 30,000 or 40,000. And I was
Mm,
like, nope, 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 never having a kid. Mm-mm, nope, can't afford it.
yeah,
It's ridiculous. And then I was thinking, like, if some parent has the very, very unfortunate luck that something is wrong with their baby right off the bat, and then they go into the NICU, ay, 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 you're screwed then in terms of cost. Because you will want to pay everything and anything for your kid to be okay.
yeah.
I forgot where I was going with that. Yes, cost. I just remembered cost. Um, okay, so you're giving them alternatives in that sense. Would you also then again be teaching parents, like, if a kid has wounds or something, like, here's how you dress them, here's how you perform this particular procedure or something?
Well, since they're in the ICU, they're pretty much there all the time. If the when the parents would come in, we'd ask if they want to help us like bathe the kid. Sometimes they
Oh,
wanted to do that instead of like let the nurse do everything. They wanted to actually feel like they were doing something for their kids. So we would let them
yeah.
do as much as they can, so they actually feel like, hey, we're being helpful and we're helping our kid.
Yeah, yeah, that's nice. That's very nice. Um, would you say that there was something you did on your part to make the kids stay in the hospital better? Like something even as small as making sure that every kid had a stuffed toy, or you chatted with them for like 15 minutes or 10 minutes to see how they're doing. Any, just how did you help the kids have a better experience?
I was very big on going and checking up on them as much as I can because I know they get lonely just sitting in the room, especially when the parents
Yeah,
can't visit. So I would
yeah.
like to whenever I have free time, I would just go to the rooms and talk to them as much as I can whenever I have time.
Hmm. Hmm.